In the dark era of the COVID-19 pandemic, our healthcare workers have served as the beacon of the light for our country and our institute the torchbearer. We have with us a pioneer who is in charge of a KEM special COVID-19 facility. With his medical knowledge and management skills, he has helped our hospital handle the enormous load in the swiftest way possible. Introducing you all to our special guest, Dr. Santosh Salagre.
Hello sir, this is Sanvida Satpute and I'll be taking your interview today. So, let's begin with the first question. Due to the sharp rise in the number of COVID-19 cases in the months of September and October 2020, how did the institute manage such a tremendous influx of patients?
Yeah, first of all, it is very important to note that this particular pandemic was completely new to us. But what happened was, since the preparation started way back from March, or rather the internal preparation started right from January when the first case of COVID was detected in our country. By the time it came to September, October, we were really well prepared. What is important in a pandemic is preparedness. Are you prepared for whatever is going to come next? Yes, so that for that, what was done prior to this was that the facilities were divided into COVID, non-COVID, and there was a particular thrust was given on augmentation of bed. Now we started in month of March with 40 bedded one of the ward. That was in the beginning of the entire pandemic, whatever preparations we started. And we reached, by the time we came in say August, on 8th of August, our last ICU, which is still functional today, was operational. So the journey of 40 to 400 was already there. Secondly, the oxygenated bed. Now, if you would have visited the wards before this particular pandemic, you would see that only 10 to 15% or maximum 20% of the general ward beds were oxygenated. Now, what happened is during these 6 months of preparedness, and as we were augmenting the beds, we also had a lot of work on augmenting the oxygenated beds. So, the number of oxygenated beds from 20% went up to the level of 90 to 95%. And that is where the most important oxygen therapy, which is mainstay in the treatment of pandemic, we could give very easily. Second thing what we did is we also augmented the beds which were there in the EMS. A lot of area was there in the EMS, and when we inspected, particularly I remember now in the month of April or May, because the in-search of patients was continuously increasing, we had identified particular locations, the corridors of the EMS and the waiting area which was converted completely into the oxygenated bed area, and where we had already had a provision of keeping 50 extra trolleys. So right from 20 capacity which was a 20 bedded capacity of EMS was doubled, and rather it was multiple times it was increased, and that is how that one aspect of bed augmentation and oxygenated bed augmentation happened. Another thing was that slowly the healthcare providers of all the cadres, including the faculty members, resident, nursing staff and class 4 employee, had already started using the SOPs and working in the COVID era so smoothly that whatever number of patients were coming more, we could easily handle them without any stress or anxiety. Another angle to this was that by the time it was very much established that what was the indoor stay of the patient which were completely stable. Does the tertiary care institute like KEM need to keep a stable patient, or by that time the provision had already started that we could transfer these patients to the other COVID facilities or CCCs as they are called as, and so that in tertiary care institute, a very important institute in the COVID management like KEM hospital, we had most of the patients which were either in a critical or a semi-critical condition. And that is why the stable patients started going up. The discharge policies was set by the time, and these also added to the continuously, whatever the beds were there, that beds were available for critical and semi-critical bed. The number of ICU beds, initially we started only with the EMS ICU of say 15 patients. But by the time we reached this particular 6 months of post-COVID, we had 89 beds in 3 ICUs, and all the 3 ICUs were completely functional. We had 2 ICUs because of the CSR activities, and our own MICU was converted by the time, and that is how the intensive care bed also were increased. Now what happened to this, another important thing is that because everything was there in place, we had our own setup of MCGM online portal for directing the patients, those who are stable, to the respective. That helped a lot. And also internally, we, our own faculty members from pre and paraclinical, had developed the apps, and we ourselves had developed our SOPs and our master charts for the Excel sheets for actually measuring the number of beds which are there, which are occupied by critical patients, oxygenated patient, non-oxygenated patient, and stable patients by various means of putting them in a occupancy data. Now what, and that was happening, updation was happening every 12 hourly. Our specialty medical officer used to go to take this data, and obviously all the wards were connected by a mobile apps and by mobile WhatsApp groups. These mobile WhatsApp group used to collect the data, and these data used to get collated at the Dean Sir's office, and that is how at any given point of time you used to know the exact situation of vacant beds or would-be vacant beds. And obviously the logistic team was there. When I was leading the logistic team, there was a team which was concentrating on the discharges and transfers, and that was also connected to our main collecting center, data collecting center, and that helps a lot in how to actually make the patient's bed available, how the continuous flow of patients would occur from EMS to the ICUs, and from the ICU areas once the patient settles, because the set protocol was there that 3 days without oxygenation, or patient on 2 or 4 liters of oxygen for 3 consecutive days, we used to transfer to the stable ward. All these processes helped us in actually augmenting the beds and making this particular, whatever load was coming, we could really cope up with that load.
How were the safety and treatment protocols followed by the team? Were they the same as the international guidelines, or were they changed according to our population?
Yes, again in January and month of February 2020 I am talking about, when the initial guidelines came, because obviously the cases were internationally there, the international guidelines came. But what is important is Government of India, particularly Government of Maharashtra and MCGM, they adopted a policy of thinking globally and acting locally. Whatever was the best possible guidelines which are doable and practical in our country, our setup, our kind of a metropolitan city where there is a municipal corporation leading 4 major institutes, tertiary care institutes, these SOPs were modified. The Ministry of Health and Family Welfare definitely were giving robust guidelines, and again Government of Maharashtra, the Health Department, and particularly MCGM, commendable work done by the Health Task Force led by none other than Dr. Sanjay Yog sir, Lahane sir was there, Supe sir was there. So all these stalwarts had every time, it was an evolving document, and all those international guidelines used to come, they used to study, they used to take inputs from the stakeholders, and they used to revise them, modulate them so that they fit in our setup. And that is how what happened, that we had a robust SOPs and guidelines. That was one aspect. What was important was that it was whatever the guidelines came. Like I'll tell you very frankly that the initial guidelines of Maharashtra Task Force which came, till date most of the guidelines are followed as they were. Only few examples, few things happened about the drugs which kept on changing. Ultimately the outcome never depended on the drug, but apart from those guidelines, the basic guidelines which were sent by Maharashtra Task Force and MCGM, they remained so robust and so time tested that was a very positive aspect of these particular things. There was no confusion. Once the guidelines were in place, once and what happened? So slowly all the stakeholders also started acting upon them. They started internalizing those guidelines, and then there was no effort. It was like a smooth journey. Since though it was a very tough journey, but it became smooth because of the robust guidelines. SOPs were made, and obviously at the institute level we had SOPs on all the aspects, like the initial document which we had prepared for the institution on all the aspects of pandemic management, including all patient care, then logistic management, then facility management, transportation, food and shelter to the healthcare providers. Each and every SOP which was made was obviously, as and when the time came, as and when the challenges came, we did little modification, but that was enforced. So what is important, this was one aspect of the guidelines. The other aspect of your question was related to the safety protocol. Now what is important is, for a safety protocol, it cannot be only on the paper. Unless there is a uninterrupted smooth availability of the safety equipments, and in this matter everybody knows the word PPE kits. Now PPE kits doesn't mean only the gowns. PPE kits also mean the masks, the shields, then all the gowns, then shoe cover, then continuous supply of whatever material which is there for using for sterilization, not only of the self but also of the various surfaces and of the floors. When it is uninterrupted and it is of quality, that was the important aspect. Like I have myself worked more than 6 months every day going to the COVID wards and ICUs non-stop without a break. But then, because I was using those safety measures which were there all throughout whatever time of the day and night in adequate number, and rather we had an excess number because we had kept an emergency stock. All our COVID wards had an additional cupboard where a 1 day or 2 day extra stocks was always maintained. It was not like the stock would be over in the middle of the night. No. So all these provisions were done and beautifully managed by the logistic department people under my guidance, where they were from various departments like preclinical and paraclinical. They used to be on call. There was something like the on-call logistic person. So all this helped in continuously safety measures. Now what happens, once you start doing this, and once you know that it is for your safety, because this is one of the illness where those who are working in that field of healthcare providers in the COVID area, they themselves could become victim to this particular or party to this particular disease process. And that is why the awareness had already come, and then the safety protocol which was already it was in place, it could be implemented. Then what we had done, whenever we wish to start any COVID facility, for overall 14 COVID facility I was the in charge, and like when we were always putting in local languages and in English all the do's and don'ts in donning and doffing, and we used to explain the students who were the new residents used to come, not only the residents, the nurses and the class our support staff, which used to be trained, and we used to be told the importance of donning doffing, and we had put all those signages. Still the signages are there, and they are so robust that if you follow the steps, definitely you will be safe. And that is how the safety protocol was maintained. Again, another angle to this is the disposal of waste. Under the guidance of Geeta Nataraj madam, the microbiology department had done extensive work on an actual practical implementation of the solid waste management. So that is how the safety measures in our institution went in a very strong way.
How did you manage the patients with chronic illnesses who had to have regular checkups? How did you ensure their health without unduly exposing them to the coronavirus?
So this is a real matter of great concern, and this is a very, very valid and a very important concern and a question which you have put forth. Now what happens, as we began in the first week of preparedness for this particular pandemic, I am very frank about it. This was the time where in the daytime I was too busy in actually training or getting trained or attending all the meetings, maybe a Zoom meeting or a in-person meeting. Middle of the nights I used to visit the CVTC building and the multi-storied building, because by the time what had happened in the beginning, the super specialty work had halted, the number of admissions had decreased, the vacant bed number had increased, and when we had the task force of KEM had identified that the building which is main hospital building would be the COVID facility, because it is the proximity of the admission entry, also it is proximity of the emergency medical services which was converted into the Sari area. It was also near all the radiological facilities and other investigational facilities were near. So, and also there were several lifts available. So entry points and they were there. In the ground floor, the additional thing was related to the entry-exit facility of the two existing wards which are still utilized as being utilized as a COVID areas. So what happened was that because one building was identified as COVID, other two buildings had that aspect that in one building everything was not there. We had a CVTC building where we shifted our medicine non-COVID work, and we had a multi-story building where we shifted our surgical non-COVID work. We went one step ahead. We identified ground floor surgical OPD as a probable place for surgical ESR. And because if the patients with a non-COVID, if they enter the area of COVID and the main hospital building, that would create a havoc. And that is why the surgical ESR, the emergency surgical services, also were shifted in the non-COVID area of the multi-story building, and that is how a complete segregation occurred. Now see, technically speaking, this segregation was there, but then what is important is the role of triage. Flawless triage has to occur, and at the entry, after the casualty officer segregates the patient, and then it goes to the triage. In the triage, along with medicine, other department residents were sitting, and they directed the patients, and all the patients with whatever respiratory symptoms, it may be because of whatever illness, they were kept in an area called as SARI. And then the 2 swab negative. What is important is the guidelines mentioned that the 2 swab negative patients should be isolated separately. So we had identified separate area as a 2 swab negative, and the 2 swab negative patients were discharged or transferred from that place only. They were not mixed with other system patients. So what happened? Respiratory illness patients remained at one place and other system patients at another place. So this actually helped us in not causing the threat of infections to the non-COVID. Now what is important, this is one of the indoor aspect. Now I run hypertension clinic, and the day the lockdown was put, from that month onward, the hypertension services, like for example, all those OPD facilities were shut down. But then some of our faculty members came forward and they started something called as telemedicine, and various, actually the provisions were made for the patients to approach the respective department doctors by a helpline, and that is how the aspect of healthcare was provided. Now what is important aspect of Mumbai as a city is we also have a secondary care hospitals, and we have various dispensaries of municipal corporation. So our patients, though they could not come because of lockdown and because of COVID, the non-COVID patients, they could not reach. Emergency obviously was running. The emergency, what we did when we shifted the medicine department to CBTC, we shifted the ICU also, because the CBTC ICU was vacant. So that ICU was, so then entire comprehensive medical care including intensive care was given in the CBTC building, and the surgical care including the intensive care and the emergency surgical case including minor operations and major operations was done in the multi-story building. So that way, that aspect, and which is very important in a pandemic like this, taking care of non-COVID patients, giving them opportunities of telemedicine, giving them helpline. This is how we have helped the entire non-COVID and COVID. This was then subsequently it came as a hybrid facility. So our hospital was hybrid facility in the true sense.
The pandemic has proved that patient care is all about the teamwork between all strata of healthcare professionals. How do you think that goes in terms of patient management in future?
If I want to start the answer to this question, the teamwork, what happens is, in our institute like us, which has 95 years of history, has all sorts of departments, isn't it? We have basic science department, we have specialty departments, we have super specialty department. But till the time COVID, what usually everybody is comfortable with is working in the 4 walls of their own department. This is the first time pandemic has given a lesson of teamwork by breaking the wall. The walls between physician and surgeon broke. The walls between physician, surgeons, obstetrician broke. The wall between different surgeons broke. The wall between different physicians broke. And everybody came under one floor of treatment to COVID patients and working in the COVID facility. This was one important major aspect of all the disasters which we have seen up till now, because there used to be surgical disaster. We used to be just taking care of the EMS effectively, and the surgeons used to take care of that particular disaster. Or for that matter, suppose there is a gas tragedy, the patient or the poisoning patients, we used to enhance our healthcare providers in that particular area, and we used to manage. But in true sense, the breaking of boundaries of the department and coming together as a team of say GSMC and KEMH together, this is what we witnessed and we are still witnessing over this entire journey, and that is basically a success. Because what happens, particularly a situation like this pandemic, where healthcare providers need a knowledge to a certain level. Whenever the residents of different departments used to come to me as a facility in charge, and every time their rotation used to change, I used to address them. My address is to start with this particular aspect of breaking the walls. You are a basic MBBS doctor. Forget at the moment your degrees of MS, MD, MCH, DM. Once they used to listen to this appeal by me that we are basic healthcare providers, whatever you say, everybody has the aura, everybody has the ego of our own degrees and specialities. That whatever is that aura of I am a surgeon, I am a physician, I am an intensivist, I am an anesthetist, this needs to go down, and it went so smoothly in this particular umbrella of KEM hospital that we had subsequently, and people got used to it. They had a bond in amongst themselves. They started respecting other professions very well. Not only the profession as a doctors themselves. The bonding started between the importance of nursing, then our support staff, because management of COVID is not only one-sided. It is not only doctors who are managing that. The nursing care is equally important. They are also threatening to their life. They are also away from their families. Our class 4 employees, and we had a very big chunk of a actual contractual basis temporary staff, because of whatever was the beliefs and this thing, the fear of working in COVID. Our initial phases, our class 4 employees were not trying to be away from the COVID work. But then these contractual basis employees used to come, and then we used to train them. I have trained batches of these class 4 employees, the support staff used to come in the middle of the night, because 11 o'clock the duty used to be changed. First duty of them in KEM hospital, COVID area. Never they have worked before. So unless we sensitize them. So there came the bonding of these healthcare providers as a team. What is important is that we have to respect other cadres. It is not that I am a doctor, so I am a leader. No. Because when you come out, the provision of your whatever cleanliness of the donning doffing area is there or not, whether all the whatever PPE kits components are there in stock or not. There was a provision of hot and cold water made, so whether the palatable water is made available by our support staff. Nursing care used to take care of our whatever food intake, or maybe a tea or a cup of coffee which had come through administration. So all these aspects you require a bonding and a teamwork. Now to sum up this, I would say there are 4 C's which are important. When you say teamwork, it is a cooperation between the various stakeholders. It is the coordination among the team. Unless there is a coordination, we are not going to succeed in our mission of combating this pandemic. The 3rd C is communication. The communication may not be by word of mouth. Communication can be just by eye contact. Communication by the non-verbal communication. And that thing that I care for you, I have an empathy towards you, I respect your work as a nurse, or I respect your work as a class 4 employee, that was sensitized to entire team members. And the last 4, which is a compassion. Compassion for the service, compassion for the whatever the aim was there. Aim was that we will combat pandemic, we will come out of it. And these 4 C's, the cooperation, the coordination, effective communication, and ultimately compassion. Ultimately why we choose a job like this, which has in that particular pandemic, it was threat to the life of healthcare providers also. So many of our healthcare providers, including our support staff, have fallen sick to this particular coronavirus. So in that situation, it is these C's, 4 C's, which have helped us a lot, and we have practically seen them flourishing in our institute.
What are your opinions about India's pandemic response? What should India learn from the pandemic?
Now, see, I know my limitations. I am a professor of medicine. I was COVID facility in charge. To talk about Indian perspective and to criticize something is not my agenda at all. But what is important is what as a frontline worker and a frontline leader of COVID, I can definitely say that whatever decisions are taken by the health ministry at the center, and excellent task force work done by our task force committee of the state government, the MCGM task force, all the stakeholders. I will not name few, but whatever important is the state leadership. I have to mention that Uddhavji Thackeray taking, and Health Minister sir taking the meetings of us, the COVID leaders, the facility leaders, and direct communication with that level, that has happened. So that is what I wanted to hint at it. We had an opportunity to interact with all these great people, the Honorable Commissioner sir, our Assistant Municipal Commissioner sir, the IS officers which were deputed for this task. So these all together, what ultimately came out was the decision of apt three things. One was lockdown, one about the strict quarantine part, and the isolation facilities which were aptly made for the stable patients, for the patients which was in the community. In the hospitals, in no time we geared up so well only because of the support and facilities provided by all these government, municipal corporation, and also many times the NGOs have come forward to support. So this is one aspect of how the India to the level of institution we have responded to it. The second part of your questions is loopholes in the healthcare. Now see, I do not want to sound like a opposition leader. So I will definitely not talk about loopholes. But yes, this is a learning lesson. We can take it as a loop. Instead of loopholes, why not take it as a learning lessons? So what is important is, I will be very frank about it, that disaster management plan, if at all it is there, it was on paper. The implementation of disaster management plan in true context is the need of the hour, and that we have sensed right from the topmost administrator to the cadre like me. We have all witnessed the need of robust, implementable, doable disaster management plan. Now henceforth, definitely because of this, whatever drawback was there, okay, the robust plan may be, but whether in a given situation it will work, and pandemic is a situation where whatever you give, whatever you provide, it will not be sufficient, because the demand supply issue is there, and supply, there is a big threat of lockdown. In the lockdown, when everything is at standstill, you have to assure a sustained continuous supply of life-saving drugs, the personal protection equipments, demand of ventilators, so on and so forth. So there requires a robust implementable plan, and that is one thing which I will definitely say, not as a loophole, but as a learning lesson for. And another aspect comes, that when we just now spoke about the teamwork, like I am the part of the system. When I, as a junior level administrator or say a leader or a manager, I am a part of a system. I cannot keep on grumbling. I cannot keep on putting at the point at the system, because I am a part of it. Whatever is the situation, I need to gear up to change that or adapt to that situation and go ahead. Because in pandemic, if all of us would have just banged that we don't have this, we don't have that, we would have never succeeded. So whatever was the situation, obviously challenges were there in the developed countries also. We have seen the entire world has got exposed. The health infrastructure of the entire world got exposed in this particular pandemic, isn't it? So that is why whatever we did, but I tell you, because of the robust plans which were there, the SOPs and guidelines, and continuously sustained supervision, guidance, encouragement by the leadership of the country, state, and MCGM and the institution, because our Dean sir, my own HOD is academic Dean sir, that Natkar sir. So they all were continuously in touch with us. They used to take inputs from us, they used to give guidance to us, and this entire thing, cascade of events, has helped us a lot. Now the third aspect was that, what is the learning aspect in this pandemic? Now I'll tell you a very important tagline I'll put here, that I look at the pandemic as a teacher. This pandemic has taught me on various aspects of my domain. The knowledge aspect of it, obviously, because this is a new disease. The entire profile is so, in the beginning it was confusing. Every patient was coming with some new things. The association between various diseases, comorbidities was slowly it came out. Then came the challenges of the age-related aspect. Then challenges came with the various drug therapies. This drug is failing, that drug is working, which drug to select. Then fortunately most of the drugs were made available so nicely and sustained, like for example Remdesivir. It was available. Whenever we used to ask for it, the next moment the patient used to get it. So no shortage of such things was there. That is one thing. So what is that lesson? That knowledge. We need to be in that busy schedule. I tell you very frankly that in this particular pandemic, myself including my other colleagues must have worked from 16 to 20 hours per day, maybe in the initial 100 days. Literally, you may get surprised to these hours, and we also get surprised that what strength we got that time to work at a stretch 16 to 20 hours, and that too under a tremendous mental and physical stress. What is important is that the knowledge in that whatever time we get and whatever soft copies of the guidelines we get, we need to read them because we want to implement that to our patients, because we were not only facility in charge, we were also the clinical in charges of the COVID facilities. I was in charge of ICU COVID for Ward 4 for 120 days. So when this is there, the knowledge has to be updated because this is a new disease and new trends were coming. Second comes the skills. Now the surgeon or an orthopedician who is posted there cannot say that I do not know medicine. Again, I tell you that the basic MBBS knowledge, and once you follow the guidelines which were so crystal clear, then there is no issue of confusion. So the skills of, say, whatever is the management of that particular patients, once the protocols are set, so the skills is another aspect. Then comes the attitude. Now very important is that when this pandemic taught us attitude, the pandemic has taught us attitude, also the communication. Now here the patients were away from their family members. The patient used to be in the ward. Many times they were not able to communicate to their family members through the phone. Family members were either they were in the quarantine part, or they were themselves not well, they were in some other city, or maybe mobile ranges were not there. Unfortunately, there were deaths of the family members. All these situations, a communication by a treating doctor was very important. So we learned communication aspects in the difficult times, and also issues came about the ethical aspects, ethical conflicts and ethical dilemmas. So I feel that personally to me, a pandemic, what I learned, basically the learning from pandemic is the holistic development of each healthcare provider has happened in the knowledge, skills and the attitudinal aspect of that particular person's development. That is the important aspect of this pandemic.
You had a hectic schedule of 16 to 20 hours at a stretch. How did you manage to de-stress yourself? Any tips on managing burnout in medical professionals?
Yes, so basically, like such kind of pandemics, and they usually come once in our lifetime, because usually if you go back to the history of pandemic, it is 100 years a pandemic comes, isn't it? And that is where what is important, the pandemic is equated with few things. Pandemic is equated with insecurity. Pandemic is equated with confusion because something it is new which is we have to deal with, and always pandemic comes with emotional isolation of a person, and in real times in COVID we have seen a stigma which is associated. When this is the thing, here is a time where there is going to be a physical and a mental stress. And yes, physical stress that is bound to be there because the kind of work which most of the healthcare providers are given, and I have given the example of our own department, myself and our department colleagues who have worked day in and day out, working 6 hours in that PPE kit in the hot and humid months of March, April, May, June. It's a terrifying thing. The kind of sweating, the kind of the the brain gets drained out, the body gets drained out, you are completely your face is covered with the fog, and you still have to perform because the next patient is immediately calling you. So this is the time of testing one's own the physical and mental stress. But what is important is that you need to understand the pandemic psychological aspect of pandemic in various aspects. Now what important, when the pandemic was actually in a full swing, our own relatives were becoming positive, my postgraduate students were becoming positive, my colleagues were becoming positive. I was witnessing the real fight between life and death, the number of deaths which I have witnessed in the shortest period possible. Then comes the issue of isolation, the lockdown state and the problems related to the lockdown which come. And then what happens is those years or months of whatever we have spent comes as whether they are major loss of our entire life if you do not take it positively. if you do not try to learn from this. So then comes the mental stress, and you should know when you have that peak level of mental stress. The friends are the one which are your guide, and I'm very vocal and I'm very frank in expressing my this reality, that there were instances where I was on verge of a mental collapse. But what I did, that as I was a leader, and I understood that if I collapse, the team which is working with me is not going to sustain, or they may have a adverse effect. So without any hesitation, I called my psychiatrist friend, and I'm here very frankly telling the names of those psychiatrist friends. One was Dr. Hinal Shah, my co-faculty and co-mentor in our medical education, and second was my school batchmate Dr. Ashish Deshpande, both of them psychiatrists, and I just talked to both of them whenever that peak came, because in the pandemic, and when you are into it, when you are a frontline leader, and when you are into this physical and mental complete turmoil, you need these kind of words. And what like both of them rather gave hints that some part of the day you be away mentally and physically from this. It was difficult, but then like I have a habit of listening to music. So one is this, how, because in that given situation for few minutes you to distress. So simple is music, because it can be in your mobile only. Then another thing was that going on a walk. But obviously because of lockdown I cannot go out of this particular campus. So I'll tell you, in Sanskrit it's called Pradakshina. So I must have done n number of Pradakshinas to KM, because our KM campus is so big. So I used to have 10 rounds, 15 rounds, whenever I used to get early morning or late evening time, I used to, so that it is to change my mood, is to settle me down. I used to think positively during those. And obviously another hobby which I have, initially to used to get a very ready-made food, but slowly as the months of say July, August, September started coming, I started cooking, because that is another distressor I have, that when I cook for myself I feel very happy. But what is important is expressing yourself. And another thing in this expressing myself is, if you see my Facebook posts venting out, this suggestion was given to me by Hinal Shah, that she said, Santosh, you went out, you pen down the things or you put it on a Facebook. So then came the stories of SBS sir coming on Facebook one after the other, and I have got series of such stories in Facebook related to my introspection, my approach to various challenges and also it is not always negative. There were some lighter moments, there were some positive moments, and all these moments are captured on by the words. Definitely once you went out, what is important is people don't went out, they keep everything suppressed in their mind, and then something bad happens. So I learned this lesson actually from this particular pandemic, that there is a need to vent out, and that is where this actually helped me. So what is important is that we have to take care of ourselves. In a pandemic situation, you cannot expect that somebody else will take care, because our family members were with not us. Our tiffin walas were not there. Whatever we have to do, we have to take care, and not only of the body, but also of the mind. Because if body and mind will work together, then only we will be able to sustain such a kind of a pandemic and such a kind of challenge in our life. So these are the things which are very important. And this is the de-stressing, which is very important. The stress was there in the environment, you can say. But in the environment, there were also some positive. Another thing which I did was I stopped watching the news channels. This is the tip. Like henceforth, any other such a things, we should stop, because what happens, your thought process gets completely shut down. You can't think beyond that television. The same negative things is coming, your mind also start become negative. So just give time for yourself. That is what is the important aspect.
How do you feel seeing the first COVID-19 patient in Jan 2020 to the availability of the COVID vaccine in Jan 2021?
Now it is, in one word, suppose I want to describe it, I will say it is commendable. Because see, our is, whatever it is said and done, our is a developing country. And throughout the Worldometer and other official webs portals of the COVID numbers, the numbers which we have seen in the entire, all the countries, entire globe, whatever we have seen, is that we always have a habit of comparing ourselves with the Western countries. We are not here to compare the numbers because the population is different. But what is important is whatever were the the era of uncertainty, the era of confusion, eras of insecurity amongst the population in say January, February, March 2020, and when we are at this moment, we could actually combat, control, whatever word you use, the pandemic effectively with the support of everybody, and every citizen for that matter is a stakeholder in this particular success. And now when we as the vaccine makers, and proudly I will take a name of Serum Institute of India, where our own Pune based firm is not only supplying the vaccine which is time tested by now, and which is not only to our countrymen, our healthcare providers, our support staff in the entire community, but it is also in a position to export it to other countries. So a commendable journey. Now this is about the country, but to the state level, or maybe I'll talk about the institution or a Mumbai level, the upgradation of the facilities, healthcare facilities for that matter, which has happened. So it is always said that it is like challenges are to be converted into opportunities. Yes, there was a challenge of COVID, but this challenge of COVID has made our wards so competent in a way that ventilatory supply, the supply of ventilators, the availability of ventilator beds, the availability of all the state-of-the-art facilities, like you name the facility and it is there now. So what has happened is, yes, the challenge was there, but the challenge can be converted into opportunity, and that is what has happened in particularly our institute and most of the institutes, and it has happened throughout the world. The health, which is so-called neglected topic, has come in a big way, and the implementation and effect of the positive effect of it we are witnessing as a clinicians of a government medical colleges and hospitals, isn't it? So that's what is the impact.
How have you grown up as a person and as a doctor after witnessing all the highs and lows of the profession?
A very introspective and important question indeed. What is important is that whenever we are facing such kind of a challenge in our life, we have to always hope for the best and prepare for the worst. As a human being, if you follow this concept, that yes, whatever talents I have, whatever capacities and competencies I have, I will use them to the best of my capacity. I will hope for the best outcome. But then mentally, if I am prepared for the worst, then the challenges become easier, the challenges become manageable. Now your question has two angles. One is as a person, how I have grown, and as a doctor, how I have grown. So as a person, I have witnessed, and in one of the such an introspective Facebook post, I have compared two coins, two sides of the coin. Like there was one side of life versus death, because one side I saw birth of a newborn in my medical ward, which never happened up till now. Two newborns were there in my ward, and I could hear the first cry of a baby in a medical ward, intensive care, because the pregnant lady was there, and then we had to deliver her there. And at the same time, I have seen the worst of the deaths in my life, people dying on wheelchair, people dying on floor, and me in the midst of the night, visiting these facilities, helping the residents and whoever was the class 4 employees and support staff available, nursing staff, to give the respect to those dead bodies. So life and death we have witnessed. We have witnessed the dilemma between empathy and sympathy. Because yes, we are supposed to show empathy, but in a particular situation, at least, what is to happen? We have heard the stories of apathy being thrown at the patient in the COVID times, in the difficult times. So that is where it disturbed. So there was a dilemma. Another aspect comes is the standard treatment protocol management versus a chaotic situation. So then we have to go from a mismanagement or a chaotic management to a proper guideline based management. So that is another important aspect we have witnessed. And then what happens is, whatever is there, we have seen again a difference. That is, we always say that government hospitals or municipal hospital, the bed will be occupied by the have-not, by the poor people. But this actually went away. We had side-by-side patients who were rejected from a private hospital and which we came, and they were occupying the patient, poorest of the poor and the richest of the rich was occupying the side-to-side way. So here I have witnessed this, and then I have realized that these gaps we only have to nullify. So as a person, everyone including me has grown up. What is important is that a differentiation between good, bad and worst. We have always that habit of complaining about the worst situation. But in the worst situation also we can do better. We can go to the best possible. That is what is the important lesson this pandemic has taught me. Another thing is that what is important is whatever is the opportunity. The opportunity has to be taken for growth. Because what has happened in pandemic, all of you, including me, we have grown as a human being. Because we have seen the sorrows of people. We could help in masses. We could communicate with thousands and thousands of people. And that has actually given a strength to us as a human being. That is one important thing. As a doctor, what is important is that as a doctor, definitely, I am a clinician, I am MD medicine, I am supposed to be master in medicine, I am supposed to be teaching medical students, medicine subject, and my postgraduates, I am supposed to do XYZ task. But if I am having some added competencies which are maybe inherited or which are there inbuilt in me, and if I have a tag of these by my official professional courses, for example, in my case, I am MBA in hospital management. Now I have to mention the name again of Dr. Sanjay Oak sir, because a decade back, Oak sir pushed me into this managerial course. And he saw to it that I first did diploma of hospital management, and he forced me into MBA course of management. Now that time I would have not listened to him. Whatever I did or whatever the God has done from my hands in those 9 months, which is like a story by itself, and these stories have people have witnessed it. It is unimaginable that a clinician working in a COVID facility for non-stop for so many months together without without contracting the illness, leading the facilities for ICU facilities that were the 120 days of my ICU whatever work the God has done from my hand. So when we look at that, my additional qualification has always helped me, because what happens is when you are having such a kind of say national MBA, or you are like for example you have an international qualification, your perspective of working changes. You do the work, 4-5 people will do the work same, but what is the change is you will do the work differently. The task will be done. But if you have an additional qualification, if you are sensitized and officially trained in a particular field, so what is important is, this is where I look at the doctor. I am not only a healer. Beyond healer, I am an administrator, I am a leader, I am a communicator, and I am an educator. So all these roles of mine come out when I look at the opportunity of COVID.
Any particularly inspiring story of a patient that you would like to share with us?
Yeah, there are series of such stories, but like for this particular interview and for a Gosumag, I would definitely say this particular very inspiring thing which we should all, this man has become a real inspiring person for me. He is a doctor himself. He served the community for 60 odd years in one of the very nearby area of KM. And when he got contracted with COVID positive, he was refused admission by 4 major private hospitals. And obviously that was in the beginning of COVID era, where the private hospitals were not forced to, or whether were not completely part of COVID facilities. So it was in the month of April. This particular doctor is a 79-year-old. He served the community for 6 decades, and he was admitted in a very critical stage. His SpO2 in the admission was 65 and his lungs were involved 70 to 72%. He was on NIV ventilation. He fought the battle so positively, and after 35 days of indoor stay in the COVID ICU ward and subsequent 10 days in the COVID facility, which was ENT ward, which was our converted, he was discharged from the stable ward. And the courage which he has shown, the positivity which came in the teamwork, and everybody at the end of this journey became fond of him, because he used to put positive inputs in all those team members. He used to encourage all of us. He celebrated, his wife was online that time, and 50th year anniversary he celebrated in the COVID ICU. What happened is subsequent. The important aspect of his journey is subsequent. After say 20 days from his discharge from the hospital, one fine day I got a call from him and he said that I am in your department. I was shocked. The lift was not working and he came walking 2 staircases up to meet all of us, to give us blessing, and he wanted to give a monetary support to our COVID ICU. Look at the commitment. The healthcare provider who served this community, the same community refused his admission. KM, he came, ultimately his daughter also was a doctor, so they decided to come. They had a faith on KM, ultimately they came here. He came out of this battle of COVID at the age of 79 in such a critical phase, and then he came back to pay back to the society by giving monetary money. In the sense, we never accepted any monetary gain. He wanted to donate some items which are important for use, that time, which were useful for our COVID wards, and he did that. So that is where this is one of the story. Several such stories are there, not only with me but so many other people, and these stories are actually, for the student, it is like learning humanity. There is nothing like class of humanity. These stories will teach you humanity. These stories will teach you what is ethics. These stories are going to teach you attitudinal competence component of your ATCOM module. You need not mug up the books and textbooks chapters for learning this ATCOM, attitude, ethics and communication. Right? So this is what is important.
And last but not the least, since you have been a leader in the COVID pandemic management, what tips and lessons would you pass on to our readers, especially with respect to handling such a situation again?
So I would, a bit of a lengthy interview, but I would summarize this now, and definitely, sustaining this particular thing now, almost coming to a year, 9 months actively into COVID, 6 months into that as a leader from frontline, from all those aspects of clinical care, logistics. Few tips and few important points which I need to narrate. One of the important aspect is, in such a calamity of pandemic or any calamity of a life, what is important is to protect yourself. If you are disciplined, you don and doff properly, you go back to your house, take your complete hot water bath, you do social distancing, you do not eat in the midst of all the people sitting together, you do not use air conditioning. All these tips have helped me in remaining away from COVID till date. That is one important thing. Now, from that, what is important is maintaining your physical and mental health. For physical health, regular 10-kilometer walk and a very balanced diet with protein, with vegetables and with fruit. That is what SBS sir takes, by the way. So I am telling you very frankly. And that is what is the actual essence of my success in maintaining the physical health in such a risky situation. And obviously for the mental health, I have already told you, went out to either a social media in a very positive way, not a negative way. Otherwise social media will turn into a very negative stories. Secondly, to your own close friends or your family members. The another angle to it is, always have a zeal to have additional qualifications. Do not stop at your goal of having a academic qualification. Apart from academic qualification, the additional qualifications definitely help you. The third aspect is mentally you should be ready to take challenges. Take life as it comes. Do not repent. Do not go away from the challenge. Obviously, there will be solutions. The people will come and help you. In this pandemic, whenever we used to have shortage, whenever the corporation supply was having or something we never used to get from corporation, somebody from my own friend circle from 1995 TNMC batch has come forward, and suddenly they have deposited that particular material which was needed desperately. So the importance is to face the challenge. Another important aspect is being an effective communicator. I still remember my COVID ICU ward rounds. Communicating with patient, they never used to understand who we are, because subsequently we also had the signages of our stickers of doctor, but they used to, because of the sweating, they used to, they never used to remain on our PPE kits. But communication with the patient, just keeping a hand on the patient's shoulder, and after the round, after morning and evening round, meeting the relatives which are there, because the relatives are anxiously waiting outside the COVID wards, and their questions, their doubts, and when we used to announce in the outside that ward for COVID, when they're in that waiting area of the patient, used to go meticulously every day and we used to announce what is the status. So for the patients which were very critical, we used to give one-to-one counseling. And when we used to say that your patient is now stable and his patient will be transferred to a step down care, the spontaneous claps used to come from the entire the group which was standing there, and its claps were not for me, the claps were from the team, claps were for the KEM hospital, and claps were for the healthcare facilities of this particular MCGM and Mumbai, Maharashtra and India. So that is where the communication comes important. And last but not the least, never forget humanity as a center stage in our profession. What is important? Harnessing the humanity. I think that is what we have learned a lot. What is important? Humanity in one tagline which is there embedded in our logo of KEM, not for self but for all. What happened in 9 months in KEM? It was the entire institution was not for the self. Institution never wanted any name. Institution never wanted any appreciation. We all worked for the cause. We worked for not for awards, but we worked for the regards, and lot of regards we received from the entire our own people, our own patients, their relatives, and that is what is the success behind this entire journey of 9 months of me, my department, and this institution. Thank you so much.
And please do like and check out our other videos from the Gosuchat series. Thank you.